Have you ever pondered over the magnitude of the COVID-19 crisis in India? It's a question that's been on everyone's mind since the first reported case of COVID-19 in India, back in January 2020. This was a time of great uncertainty, a time when a new virus was making headlines around the world. India, like many other nations, was grappling with the unknown. The initial response was swift and decisive. The government implemented measures designed to contain the virus and protect the population. Travel restrictions were put in place, screening procedures were ramped up at airports and borders, and a nationwide awareness campaign was launched. But these measures, while necessary, were only the first steps in what would become a long and challenging journey. In the face of the pandemic, India was about to test its resilience, its healthcare system, and the strength of its people. Little did we know, this was just the beginning of an unprecedented crisis. As days turned into weeks and weeks into months, the situation escalated. The mid of 2020 saw a rapid increase in COVID-19 cases throughout India, despite stringent lockdowns and preventive measures. The virus was relentless, spreading like wildfire, leaving no corner of the country untouched. In the face of this escalating situation, the healthcare system was stretched to its limits. Hospitals were overwhelmed, with doctors and nurses working round the clock in a race against time and the virus. Resources were scarce, and the demand was insurmountable. The tireless warriors of the medical fraternity were fighting a battle, the likes of which they had never seen before. The economy, too, bore the brunt of this invisible enemy. With businesses shuttered and jobs lost, the financial fallout was severe. Day-to-day life was upended as people grappled with the new normal of masks, sanitizers, and social distancing. The impact was far-reaching and profound, touching every aspect of life. The bustling streets of India were eerily quiet, the vibrant festivals muted, and the relentless hustle of daily life brought to a standstill. The country was in the grip of the pandemic with no sign of respite in sight. Just when we thought we were seeing the light at the end of the tunnel, the second wave hit. Early in 2021, India was blindsided by a second wave of COVID-19, more severe and more challenging than the first. The virus returned, not just stronger, but also more unpredictable, with new variants that left scientists and healthcare professionals grappling to understand and control. The second wave was like a tempest, sweeping across cities and villages, sparing no one in its path. Hospitals were overwhelmed, resources stretched thin, and the spirit of the people tested like never before. The new variants of the virus were more contagious, more virulent, and seemingly more resistant to the existing measures. Amidst this storm, the nation witnessed a unity of purpose and a collective will to fight. Yet, the second wave was a stark reminder of the unpredictability of this virus, of the constant need for vigilance, and the importance of scientific research in combating such a crisis. The second wave proved to be more devastating than its predecessor, leaving the nation in a state of shock and despair. But in the midst of the chaos, there was a glimmer of hope: vaccines. With the unrelenting waves of the pandemic, India saw a beacon of light with the commencement of the vaccination drive. Some of the world's most effective vaccines were made available to the population, including Covishield, Covaxin, and later, Sputnik V. The initial response was a mix of relief, apprehension, and a dash of skepticism. But as more and more people started getting their jabs and the real-time data began showing a decrease in severe cases and mortality rates, the tide of public opinion began to turn. Vaccines play a significant role in controlling the pandemic. They not only reduce the severity of the disease in individuals, but also decrease the overall transmission rates, helping to curb the spread of the virus. In a country as vast and diverse as India, the vaccination drive was no small feat. It required meticulous planning, extensive resources, and relentless effort from healthcare workers, volunteers, and the government. Yet, it was a mission that had to be undertaken, a crucial step in the battle against the invisible enemy. The vaccination drive marked a crucial turning point in India's fight against the pandemic. So where do we stand today, and what have we learned from this crisis? As we move forward, we find ourselves in a state of cautious optimism. The situation with COVID-19 in India has seen significant improvements. The vaccination drive is making steady progress, with millions having received their doses. We are witnessing a decline in cases, which is a testament to the collective efforts of our healthcare workers, government bodies, and the public at large. But what has this crisis taught us? The pandemic has underscored the vital importance of robust healthcare infrastructure. It's a wake-up call, reminding us to be prepared for any future pandemics. We've also learned that every life is precious, and we must do everything in our power to protect it. The crisis has also shown us the value of unity and the strength of our community. It's in times of adversity that we truly understand the importance of standing together, supporting each other, and working towards a common goal. As we continue to grapple with the pandemic, let's not forget the lessons it has taught us and strive to build a healthier and safer future.